Welcome back to TSC Connect. I'm Physio Andrea, and in this video we have a gentle movement routine that's made for a very special population. Those of you who have had spinal fusion surgery within the last year or so and are looking to get back into exercise. First, please make sure that you have been cleared by your spine surgeon to start these gentle exercises. These movements do not involve weights, they don't traction the spine, and most importantly, they are focused on helping you move and strengthen the muscles around the other joints of your body that will need to do a little bit more movement now that your spine is fused. So your neck, your shoulders, pelvis, and hips. You'll hear me give cues to remind you to keep your trunk and spine neutral as we want to protect and support your fusion as you continue to heal. Again, as with any orthopedic surgery, get the okay from your surgeon and anyone that's following you for rehabilitation before starting a new program or exercises like this one. Your body will feel different than before surgery, and a lot of what we'll do today is try to strengthen your brain's connection to your body's new alignment. Let us know if you have any questions. Otherwise, enjoy this gentle movement routine for people who have had spinal surgery. We'll start our post-op spine surgery gentle movement routine with a body scan. So sit on a sturdy chair and come towards the edge of it or the middle of it where you can actually sit on your sit bones. And so if you've recently had spine surgery, you probably feel like your body feels different and your weight is distributed differently because your scoliosis curve has been corrected. And so just close your eyes, and we're starting to just try and reconnect your brain with your new alignment of your body. So let's start from our feet. We're gonna work from the ground up. So starting with your feet, just wiggle your toes and feel the bottoms of your feet pressing into the mat. And just bring your attention there. Slowly moving your awareness up towards your knees, feeling how they're both bent, your legs are supporting you. Drawing your attention to your pelvis now. Just pay attention, where is your weight distributed? Is it on your left sit bone or your right one? And just see if you can try to make it as even as possible. Bringing your awareness up into your lower abdomen and to your lower spine. You might feel that your back might be a little bit numb in some areas, or that you feel a little bit different in that area. That's okay. And just notice that. Bring your awareness to it. Deep breaths. Drawing your awareness up your spine into your thoracic area. If you still have stitches in that area, it might feel a bit tight, or again, you might not be able to feel that area at all. But just try and take a nice deep breath and feel the front and the side of your ribs expanding to lift as you breathe and exhale. Good. Notice if you're holding tension in your pelvis or in your back. And on your next breath, try to just release that tension a little bit. You're supported. You don't have to grip and hold as much. Good. Draw your attention up towards your chest, your collarbones, and your shoulders. Often after surgery, people feel like their shoulders are not centered or that they're twisted or rotated. That's also okay. That should change over time. And just slowly bring awareness to where your shoulders are. If you're holding tension in your neck, do gentle movements of your head and your neck to try and encourage them to relax. And then also bring attention to your neck and your jaw, your face, making sure you're not clenching. Feel your eyebrows and your forehead, if they're furrowed or if they're tensed as well. Just try and relax them before we actually get into our movement routine. One more deep breath here. Exhale, and gently open your eyes when you're ready. Okay, so continuing with our body awareness work, but this time we're really adding in deep breaths. So if you want, you can place your hands on your rib cage if that helps, or you can just keep your hands resting on your thighs. So when you take a deep breath in, I want you to notice, where does it feel tight in your back. You might feel like one side feels tighter. Sometimes after spinal fusion surgery, muscles that were tight before the surgery may still be tight after, even though your x-ray looks different. And so that's where this breathing and awareness work comes into play. And so deep breath in, just notice, is one side of your back more tight, or does it feel more restricted than the other? Some people say, oh, it feels like I can't push air into that area. And don't get frustrated with it, just notice it and try and bring attention to where those restricted areas on your back. We're going to do 3 more deep breaths. Noticing with your brain, trying to increase that brain and body awareness. 2 more breaths. This time, bring your focus to the front of your rib cage. Feeling if there's a difference in how that air feels from left to right as it enters your rib cage. 1 more nice deep breath. Noticing and releasing. Good. And rest. Okay, so now we're starting with some gentle range of motion. Depending on how long ago that you had your spinal fusion surgery, make sure that you've talked to your surgeon first to clear these movements, but we're going to focus on trying to gently move the areas of your body that are not fused, because they're going to need a lot more mobility. So let's start with our neck. We're doing some gentle range of motion. So first, bringing your ear towards one shoulder, trying not to change the position of your spine, staying really anchored into your pelvis and level through your shoulders. Good, come back to center, and we're going to the other side, ear to shoulder. Good, let's do that 4 more times. Going to that first side, bring your ear to your shoulder. Feeling a gentle stretch, you might feel a difference from side to side, and switch to the other one. Good, we have 2 more. Come back to center and go to your first side. Last one, ear to shoulder on the second side. Good, from here we're doing gentle neck rotation. So trying to keep your face straight, so we're not tilting, keeping your face straight. Just think about rotating to look over one shoulder as far as you can without twisting your body. And so this is one of the important skills that you'll learn as your spinal fusion heals, is that you're going to need to be aware of how to move those joints that aren't fused separately from your trunk. And so really focusing on just doing neck rotation here and coming back to center, going to the second side, thinking about trying to look over your shoulder or as far as you can without tilting your head forward or backward. Again, keeping it nice and straight. Coming back to center 2 more times. Rotating over to look over one side. Back to center, and 1 more neck rotation. Good. Come back to center and rest. Next, let's move on to shoulder circles, this time keeping your elbows bent. So think about bringing your shoulders forward, but the trick here is you don't want to round your spine. Because you've had fusion, certain areas of your spine are going to have a fixed position. And so especially in the healing phases, we don't want to create any stress on those areas. So really think about just bringing your shoulders forwards without changing the position of your spine. From here, bringing your shoulders up towards your ears, and then thinking about lowering them back and down, but trying not to arch your back. Again, trying to stay as neutral as you can while it's just your shoulders moving. If it's easier, sometimes that's hard to coordinate, you can kind of think about using your elbows to help you too. And again, always thinking about keeping your head and your rib cage centered over your pelvis so that they're stacked, and then it's just your elbows and your shoulders that are moving. Go really slow and just feel where it feels tight. So for me, in certain areas, I can feel that across my chest and my collarbones. And just do 3 more, going in reverse without changing the position of your body. 2. 1 more. Good, this time changing directions. So going back first with your elbows and your shoulders, up towards your ears, and then bringing both of them forward. Good. A few more just like that. 2 more. And last one. and rest. We're continuing with shoulder range of motion, this time with your arms extended, to try and get a little bit more of a stretch through your triceps and your biceps and through the rest of your arms, your forearms and your fingertips. So this time, extend your arms. You don't want to lock them straight, so gentle bend. And we're also doing those arm circles, so sweeping your hands forward and reach forward again without curving in your back, trying to stay nice and neutral, reaching your arms up overhead, and then you can splay your fingers, spread them wide, and lower your arms back towards your side. You might feel some tightness or some tension across your biceps or your chest. That's normal. Just if it feels uncomfortable, just make the range smaller or make your circles smaller. So let's do that 3 more times in the backwards direction, thinking about really reaching those fingertips all the way around, trying to stay really neutral through your spine. Only go as wide as it feels comfortable. If this is one of your first movement sessions after your surgery, you might want to start with some really small circles. A lot of it is just getting used to your new body and feeling comfortable moving in it. And so only go as big as you feel comfortable. Good, let's go 3 times in the other direction, sweeping those fingers out to the side, reaching up to the ceiling, and then circling forward. 2 more. Good, and this is your last one. Keep your thumbs facing up towards the ceiling. And then rest. The next movement is a hip hinge. Depending on your spinal surgery, make sure that you clear this movement with your surgeon, but we're trying to focus on hinging our hips because this is an essential movement that you'll have to do for the rest of your life if you're picking things up or bending. But the key thing here is that we're trying to train your brain to lean forward without rounding your spine. Okay, so think about if your whole trunk moves like a board and the only leaning movement comes from your hip. So we're thinking about leaning forward, closing this hip angle, and then coming back up towards sitting. Start with your hands on your thighs so that your arms can fully support you. You're just doing small ranges. Sometimes another cue that helps is when people think about opening your sit bones backwards. So as you lean forwards, you're creating some space between your sit bones and then coming back up towards sitting. Because what you don't want to do is hold and grip through your glutes, because then that's what causes the rounding of the spine. So we're just trying to always make sure that you're hinging through your hip and pushing back up. Okay, let's do that 3 more times. 3, really small range. Don't go all the way forward. Good. 2 more, loading through those feet. Good, and 1 more. Good, and rest. This time we're continuing with the hip hinge, but we're adding a dynamic hamstring stretch. So hamstring mobility is also very, very important after spinal fusion surgery. So from here in sitting, just reach 1 foot forward so that you're propped on your heel. We're doing the same movement. We're hinging forward, thinking about spreading our sit bones backwards so that you really get that tilt of the pelvis. I feel it here in my hamstring, and then I'm going to press back up to stand, okay? Let's do that 5 times on this side. Again, using your hands as much as you want. 5. Good. 4. 3. Small ranges. 2 more. 2. Good. You can keep that knee bent as much as you want. Last one. Good. Switch sides. Let's do 5 on the other side. 5, going until you feel a gentle, gentle stretch in the back of your thigh. 4, pushing through your hands as you need. 3, 2 more. Last one here. And then coming back to sitting. Okay, so trying to reactivate your core after a spinal surgery, this is where you can work with your physical therapist or another healthcare professional who can help you. But in sitting, there's a nice exercise that's really gentle that we can do, and it's just marching. So if you like, you can keep your big toe on the ground and just push off of your heel and gently, just place gentle weight on your big toe and then switch sides. You should be able to feel your core is working as you're shifting the weight between your feet. Or if you want a challenge, you can actually lift that foot off of the floor and then go to the other side. So if you feel anything in your back throughout any of these movements, of course, stop and ask your healthcare professional if these movements are appropriate for you or if you need any support during them or some rehabilitation specifically for that exercise. But doing some gentle marching just to gently activate that core. Let's do this 4 more times. 4, 3, 2, 1 more. 1, and rest. Next, we're transitioning into a standing movement. So you can gently stand up and position yourself behind your chair. Make sure again that it's a sturdy chair where that has a high back that you can hold on to for support. And so we're starting with calf raises. So with both hands on the back of the chair, keep your feet about shoulder or hip width apart. And from here, you can lean as much as you want onto the chair, but we're gently transferring your weight forward. So you're leaning a little bit and then we're rising up onto our toes and then slowly lowering back down to your start position. A few things to remember here: when you rise up onto your toes, try and push through your first and second toe quite a bit through your weight, because if you only push through your baby toes or your fourth and fifth toes, then your ankles might end up kind of collapsing out towards the side. So make sure you're pressing into your first and your second toe. Let's do this 5 more times. 5. And 4 more times. 4, lifting up onto your first and second toe. Good. 3 more times. Good. 2. Pressing into the chair as much as you need. Last one. 1. And rest. Okay, next we're doing some mini squats. So still holding on to the chair. Again, a very gentle movement, a small range, but basically just trying to wake up your quads, get them moving. So keeping your feet, you can put your feet as wide as feels comfortable here, and you can turn your feet out if you prefer as well. Just keeping your body nice and straight, bend through your knees to lower your pelvis down a little bit, and then push back up through your feet to standing. Keeping your hands leaning on the chair if you need to, but try as much as you can to activate your core and stay, as supported as you can. So lowering down into a very small squat and then standing back up. Good, let's do 5 more. 5. Making sure you're breathing the whole time. 4. 3. 2. Last one. Good, and you can rest. Next, we're activating our hamstring muscles. So stay standing behind your chair. You can hold on for support. Bring your feet close together. We're starting with one leg, keeping your knees connected to each other. Think about trying to curl your heel up towards your bum, and you'll feel your hamstring activating on that one side. What you try to avoid kicking and using momentum to get that movement happening, and try not to crunch down like this as you bend your knee up. Really, nothing is changing in terms of alignment. All that's happening is that you're bringing slowly one heel up towards your bum and then lowering it back down. This is actually a harder movement than it looks, and so even if you just do a small range and then tap your foot back down, that's totally fine. Good, let's do 5 more on this side. 5. Staying nice and strong through your standing leg. 4, that can be really challenging too. 3, 2, 1. Switching sides. So again, see how it feels, your first one. It's gonna feel different, especially after your spinal fusion. Your left and your right sides will feel very different, and your muscles are just getting used to working in your new alignment. So let's do 5 more on that second side. 5, again, trying to make sure your pelvis stays neutral. 4, good. While you're standing, try not to collapse into your hips. Stay really active in your standing leg. Good. 3 more on this side. Heel towards your bum, activating that hamstring. 2 more. And this is your last one. 1, and rest. For our last standing exercise, we're going to introduce single leg balancing. So it's really important that you have a chair here that's sturdy. Again, keeping your feet together to start. First, think about peeling one heel off of the floor and seeing if you can just shift your weight to one leg that's going to take most of your support. Make sure that that hip, your supporting leg, is really strong and you're reaching the crown of your head up towards the ceiling. If you're able to peel your weight of your foot up onto your toe, that's wonderful, and see if you can even lift it off of the floor ever so gently. Now from here, if you want to challenge your balance, find a spot in front of you and really focus your vision on it, and then you can gently lighten off of your hand support. So go from full support, maybe shift to 3 fingers that are just touching, 2 fingers, even one finger on each hand, and just tapping the chair just to give you some feedback about where you are. And then if you're able to, try to balance on that one leg for even just a few seconds, noticing how it feels. Good, just try that for a few more seconds. 5, 4, 3, 2, 1, and we're switching sides. So placing that foot back down, really anchoring down into your foot, keeping your leg active, your hip active on that other. Now we're switching sides. And then again, we're peeling the opposite heel off of the floor first onto the big toe, keeping your supporting leg hip nice and strong, lengthening up to the ceiling, and see if you can lift that foot off of the floor, and then start to change how much support your hands are giving you. So again, you can move to 2 fingers or even 1 finger, focusing your vision on a point in front of you, and then seeing if you can lighten up off of that chair with your fingertips to balance. You'll probably notice that one side is harder to balance on than the other. And again, that's totally fine, but it gives you something to work on. Good, hold this for 5, 4, 3, 2, 1, and return to standing on both feet. Let's close our movement session by standing freely away from the chair. And we're doing some deep breaths with arm sweeps, which are my favorite for people who have scoliosis, Sherman's kyphosis, or who have had a spinal surgery, because it's really engaging the rib cage, using the muscles of the arms and the back to try and help with that deep breathing, which is so important. So you can widen your stance if it feels more comfortable. Spread your fingers out to give some energy into your arms too. As you inhale, lifting your arms overhead. Keep your hands in your view, so you can kind of put them at out in front of your forehead or your hairline, and then you can sweep them back down. The reason being, if I cue you to lift your arms up overhead, sometimes what happens is it causes an arch in the back, and so the unfused areas of your spine might be tempted to collapse into more of an arch position, but really we're just trying to focus on that sweeping motion of the hand without changing the position of the body. Good, 3 more like this. Inhale, keeping your arms within your vision. 2 more, picturing your ribs lifting up and open. And this is your last one, inhaling. Exhale. And as you stand here, just notice how your body feels after doing that gentle movement. Thank your body for moving. Be patient with it as it adjusts to its new alignment. And we're finished.
We hope you find this information helpful. For more how-to videos and scoliosis-friendly workouts, check us out on TSC Connect. See you next time.